tonight on a Diabetes Chat, we are joined by DSN and Eden educator James Ridgway, Assistant Director of Eden, Laura Wilcock, and Julia Burden from Desmond. Eden was set up in 2012 and is a comprehensive training and skills assessment program with a sustained and successful track record in Leicester, providing and delivering education locally, nationally, and internationally. Desmond's mission is to design, deliver, and embed world-leading learning, evidence-based education and support for people with or at risk of type 2 diabetes and other long life conditions as well. So tonight, I think it's really going to be really fascinating. As I said earlier on in our welcome chat, that our community is inclusive to everyone of all types of diabetes, from people who are newly diagnosed to people who've had diabetes 40 years plus. We are inclusive to parents, carers, partners, you name it, and healthcare professionals. And primarily, I think James will agree, I think we seem to be more type 1 based, which is absolutely fine. But we do have people from type 2 and other types of diabetes that come and listen and join. But tonight it'd be really fascinating hearing both aspects of type 1 and type 2 diabetes. So it's great to welcome Eden and Desmond tonight. We'll be talking about education, why education is important. We'll be talking about self-management and education tips, peer support, and lots more, I'm sure. So without further ado, welcome to Laura, James, and Julia from the Leicester Diabetes Centre, Eden, and Desmond. Hey, guys.
Hey, thank you again. Really grateful to be here.
Yeah, thanks for having us.
Awesome. Awesome. So what we'll do is, I know we've been planning this chat for a good while now, and I really appreciate all the hard work from all you guys in helping set up tonight. But I think before we sort of hand over the mic to you guys, and we've got a few people on the panel, and people, if you want to come join, you can, and maybe you'll have questions to Laura, Julia, and James, is I think let's have a bit of context really of who we're talking to and sort of what Eden is and what Leicester Diabetes Centre is and what Desmond is. So can we maybe start with Laura, then James, and then Julia? Can you briefly introduce yourselves, give us a little bit background to who you are, maybe your current role, and yeah, let's start with Laura.
Thank you, Tom. Yeah, so I always describe myself as a bit of a square peg in a round hole because I'm a physiotherapist by background, and so is Julia, but I'm sure she'll talk about that a bit as well. And it's not usual necessarily that it's the sort of role that you find a physio in. So my background is fairly different in that for many years I worked in sort of medicine, neurology, spinal injuries. But I often think there's a lot of crossover and correlations with it because I've got a number of passions really. One of those has always been patients and people. And then over the years, the other passion of mine that features really strongly is around helping people develop and grow. So sort of leadership, training, development has been a natural part of my role. And I worked in a role doing that in a hospital for many years as well before I came to Leicester Diabetes Centre in about 2014 originally. So I was working as a physio at the time and chose to come and work as a healthcare professional educator on a number of trials, so patient education sessions. So I worked on some programs called Let's Prevent and Propels, which was a physical activity prevention study. So I was an educator on that. And at that point, somebody then asked me, did I fancy coming to work full time at Leicester Diabetes Centre, which I'm sure we'll talk a little bit more about in a minute, and leading the education team there. So I said I would give it a go. And that was back in about 2015-16. And I'm still here. So what's that, 7 years or so on? So yeah, my job is to lead some of the education services at the centre. I work leading healthcare professional training in terms of both Eden. We also have a master's programme in diabetes that runs out of Leicester Diabetes Centre. Yeah, and they're still pretty much my passions, really, people and patients. So I've managed to find a job that fulfills both of those. So pretty lucky most days. Shall I pause there? Is that okay?
I'll go, Laura.
Thank you.
That was absolutely incredible. Thank you so much, Laura, for sharing that. Julia, do you want to give us a little bit background to who you are?
Well, like Laura said, I'm a physiotherapist as well, and I've worked clinically and in research in the NHS for the last 23 years. Originally, I was working clinically very much more in cardiopulmonary respiratory rehabilitation programs, working in the hospitals here in Leicester. And then had a bit of a career break, just sort of for a year, and then started doing some work in the community, doing some cardiac stuff again. And then whilst I was doing that, I was contacted by colleagues that were now working at the Leicester Diabetes Centre, and very similar to Laura, came along and did a bit of work on a couple of projects, one of which was a project looking at sort of cardiovascular education, a year and beyond after somebody had had a heart attack or heart surgery. And then also working on a project where just talking to people about their long-term conditions and what they were doing to help sort of self-manage them, and just generally having that sort of group peer support and self-management advice, really. And it was kind of through that then got a bit more involved in the Leicester Diabetes Centre, and now work as a Desmond national trainer and educator, based at the LDC, like I've said, and as well as that, work on a couple of other research projects across the centre, so not just with diabetes but with other long-term conditions as well, so developing some of the complex interventions that sort of run within those programmes. So sitting across a few different teams within the LDC, so find it very busy but very enjoyable, and it's become it's a great place to work. So I've really enjoyed. So I've been working really for the LDC for the last sort of 4 years or so. So that's me in a nutshell.
Brilliant, thank you so much. Very rewarding, like you say. And to James.
Hello. So for those that don't know of myself, so I'm James Ridgway. I work in 2 roles in the NHS. So one is for Eden as a diabetes educator, as I like to know it, and I've been with Eden for it's almost 5 years now. Blessed to be, which is a really great team within the Leicester Diabetes Centre, and also a diabetes specialist nurse for the University Hospitals of Leicester NHS Trust as well. And that position led from being honoured almost to have a position within Eden itself. And I've always wanted to be part of the world of diabetes from a professional perspective as well. And that's really from, as some may know, from my own personal diagnosis of type 1 diabetes, where I had a delay in my diagnosis. And it was from that I wanted to have an input in terms of being part of some form of upskilling of knowledge and confidence to healthcare professionals, but also give back to patients. So very proud to have both roles as in education, and also as a clinician, as a diabetes specialist nurse. And Eden is one of the great teams within the Leicester Diabetes Centre. It's a marvellous place to work, and I always think that the people that go away from the Diabetes Centre itself are things for either really things that they want to, that they have a passion for, or for bigger things itself. And I have no intentions to leave, because I think that I've got the best of both worlds where I'm at, really. And we'll talk about how diabetes education, from both a personal, from a patient perspective, and as a healthcare professional perspective, can make the diabetes world a better place. So that's a bit about me.
Absolutely great. Thank you, James. And I look forward to hearing the 2 sides of that perspective. And I know we've had so many chats about your role as a Eden educator, but also as a DSN and working with patients as well. So absolutely great stuff. Thank you so much, Laura and Julia and James, for giving us a little insight to you and your background. So why diabetes? What fascinates you about diabetes? And why do you want to help others with diabetes? Let's start with Laura.
Yeah, thank you. That's a really good question. I was thinking about it earlier when I saw that you'd asked us it as well. And I think when I think back to early parts of my career as a physio, and it sounds a strange thing to say, but I always describe myself as I would never have been the best physio in terms of what I did with my hands. And that's physio is a hands-on profession, particularly the areas that I worked in. But what I would say I was probably best at, or what really floated my boat, for want of a better word, is that ability to talk people better, I used to say, or to talk to people. And I guess if I had a gift, it was probably that gift, I would say, of being able to connect with people, that ability to step into people's shoes. And I worked in spinal injuries for many years, which is a really full-on sort of service with many people, our age, who have the most horrific injuries and are rebuilding their life, if you like, to a degree. So they're the really meaty, gritty things that I like to get my hands into. I was never one of these physios that wanted to just sort of do a knee or a hip or a shoulder. I just wanted to do the whole person. And I guess that's where the full circle bit for diabetes and long-term conditions has come for me, because it's just that ability to be able to see the whole person and to work around things in an education way. I'm really passionate about sort of strong teams, team spirit, and I'll talk a little bit about that. I'm really passionate about leading with compassion and the difference that makes to patient care. And I guess no 2 days are the same. The growth in the field of diabetes, which might not sound exciting to you guys, I guess, who are living with things day to day, but the investment and the challenges and the progress and the growth in diabetes is just so fast. It's almost a challenge to try and keep up and stay ahead of the curve. And that's one of the things that I particularly love about it as well, being able to foresee what's coming next so that we can develop resources to help healthcare professionals, help people like yourselves.
That's absolutely amazing, isn't it? And like you say, like things have really, the last, say, 5-10 years, technology-wise, are really evolving, isn't it? And we can see the excitement with things such as now with CGMs, the news this week with Abbott announcing the Libre 2 will be turned to CGM, and then things like the hybrid closed looping and so many other things. So absolutely brilliant. Thank you so much, Laura. Julia, what about you? Why diabetes? What fascinates you about diabetes? Like Laura says, is no 2 days is the same, is it? And that's quite exciting, right?
Yeah, definitely. And certainly working clinically, diabetes is a condition that you come across in an awful lot of patients. So certainly from my background in cardiopulmonary rehab, although those classes were very much designed for people with cardiovascular disease, so like I say, people that had heart attacks or heart surgery or angina, there was sort of a third of them that were suffering from other long-term conditions, and one of the common ones was diabetes. So I've been working with people with diabetes for a number of years. So when this opportunity came up sort of within the Diabetes Centre to look at it in a little bit more detail, and because my passion is kind of coming back from that physical activity background, feeling that there was something still to offer into the world of diabetes around that sort of lifestyle rehab and the physical activity in particular. And at the Leicester Diabetes Centre, there's a big lifestyle team and physical activity team that are looking at sort of pushing the boundaries with research and how that can help people living with long-term conditions such as diabetes. So that was the big pull for me, certainly having worked with people with type 2 diabetes for a long time.
Brilliant. And James?
I don't know if I kind of said it in the starting bit, but yeah, so my reason why was to give back to the community in a way, and give back to healthcare professionals, but give some upskilling of knowledge and confidence to both parties, really, and that's all kind of stemmed from my personal diagnosis. At the time, I was in my second year of nursing, and so I knew that the healthcare professional side of things is where I want to go, and I never really had an idea of what I wanted to do at that point in your training. It's, I think, for many nurses, they don't really know what they want to do until they're going into the world of nursing, and sometimes many years down the line. But my personal diagnosis, it obviously not straight away, because of the trauma that a diagnosis of any long-term condition that can cause you, especially type 1 diabetes, admitted to hospital at that time, you don't initially think it, but then after a few weeks and months of living with the condition, I started to reflect on the experience and think, what, this is where I feel I want to make a difference in, no matter how big or small that may be itself. And Tom, you mentioned of technology, hybrid closed loops, etc. Partha obviously did a nice little tweet about it, which sounds encouraging. But also the world of type 2 diabetes, which we at the Leicester Diabetes Centre not just focus on type 1 diabetes, but type 2 diabetes, the whole that whole management of that condition itself is changing vastly from the management of, for example, very low calorie diets, the use of medication therapy as well. When we used to think about one of the best strategies in terms of weight management was bariatric surgery. Now we have two other great opportunities, and which has all kind of been part of a weight management service as well. And all that stems within the patient receiving good care within both primary and secondary care. And ourselves in Eden obviously focus on that particular area in primary care, but also secondary. And one thing we do in our sessions for anyone in primary care is to think about structured education, self-management education, and we certainly do talk about Desmond and how proud that we are as well of having this organisation embedded within the Leicester Diabetes Centre as well. But my why is all stemmed from personal perspective, and I always try and have my empathetic hat on as well. And I always say that empathy thrives connection and sympathy drives disconnection as well. So try and be as empathetic as possible. That's one thing we try and say to our participants, our healthcare professionals as well.
Yeah, absolutely brilliant. Thank you so much, James. So two final things I want to ask before we hand over to you guys, because you guys are taking over tonight and I am here, so I can join in discussions. And anyone else that wants to come along and join, you can request a mic or tweet, press that little blue button at the bottom, and you can ask questions to get involved. So before we hand over to you, two final questions I wanted to ask. Can you share with us a little bit about what Leicester Diabetes Centre is, what Eden is, and what Desmond is? And then also what I thought would be quite nice as well, an extra question is, tonight we're talking about type 1, type 2 primarily. Would anyone be able to maybe just give a brief overview of what type 1 diabetes is and what type 2 diabetes is?
Perfect. Shall I start, Tom, and I can do a little bit briefly on LDC and Eden, and then maybe Julia can do Desmond and James can pick up that final question if we do those briefly for you as well. So
sounds brilliant.
James has already alluded that Leicester, can you hear me?
Absolutely, yep.
Yeah, James has already alluded that Leicester Diabetes Centre is a great place to work. And one, I don't know if any of you have ever had a chance to go there, but the environment is just absolutely amazing. It's in an acute hospital, but it's a really purpose-built building. So I think environment says a great deal about where you work as well. But there's about 200 plus staff working at Leicester Diabetes Centre now, and they're a range of people. Some are education staff, some are academics, as in they're doing the research that we've talked about into lifestyle, into prevention, into ethnicity, into all different areas, and then some are clinical. And 3 strap lines, actually. If you walk up the stairs at LDC, the strap line says that Leicester Diabetes Centre is about research, innovation and education, and at its briefest, that's it in a nutshell. So we educate both people living with long-term conditions and diabetes and staff. We try to innovate, and then we try to implement those innovations to make them into the real world so that people can benefit from those, and then we carry out that research that enables us to do that. So that's the fundamentals of LDC. And then Eden, as you said really in your introduction, it's very practical, pragmatic education for healthcare professionals. Now, there's loads of education providers out there, Tom and all, you know, they're 10 a penny. You could literally sit on a webinar from morning till night as a healthcare professional. And particularly since the pandemic, you know, those invitations are out there from dawn till dusk. I'm not saying we're different. I'm not saying we're better than lots of other people, but obviously I'm a bit biased. I think what we do is we do very practical upskilling. So we're not the diabetes masters, because that's your sort of academic accredited education. What we pride ourselves on is having really practical upskilling of all different healthcare professionals and staff. So that might be GPs, nurses, doctors, pharmacists, and loads of the new roles that you see in your GP surgery. So your paramedics, your physios, your social prescribers, all different roles. And we basically provide and develop education programs for all of those staff so that they can do the care for people as best they can. And I'll talk a little bit more about that in a few minutes, if that's okay.
Absolutely brilliant. Thank you so much. That gives us amazing insight to the Leicester Diabetes Centre. Over to you, Julia.
Thank you. So the Desmond programme is a national education programme for people with type 2 diabetes. It's sort of a programme that puts the patients at the centre of everything. It has a very much a style of delivery where patients are introduced. I think it's around sort of 6 hours of sort of workshop activities that they can do group wise, face to face, virtual. And then we also have online self-management programs as well, but within our sort of face to face programs, very much around that non-didactic, very interactive, but all underpinned by what we call our Desmond philosophy. It's a very patient-centered care, but also looking at sort of the adult learning theories that we have used within the structured education programme to ensure that people are getting the right kind of support and are learning in the best way possible. So very much has gone through quite a lot of restoration and recovery sort of post-pandemic with everything that changed. So that's sort of changed the programme slightly. But for us, actually, certainly over the last year, we've been training some of the biggest numbers of educators across the country. So very much, spreading that word and looking at delivering Desmond across the UK wide, as well as internationally and as well. So Desmond's in Australia, it's in Gibraltar, the Isle of Man, it's in some parts of Africa. It's been adapted for different places. So very much about that sort of type 2 diabetes self-education, self-management education programme for Desmond.
Thank you so much, Julia, for sharing a little bit more about Desmond, and Laura for sharing a little bit about Eden as well. Over to you, James. Before we hand over to you guys, what is type 1 diabetes? What is type 2 diabetes?
So we try and put this in a nutshell. That's a good task. So one thing I always say to any healthcare professional in any training but also any patient is to know, well, especially healthcare professionals, to know what type of diabetes a person has, because everyone is very different itself. So we know that almost 5 million people in the UK live with diabetes, though we say a missing million. And that's due to the way that generally the body copes when in relation to type 2 diabetes, because the body's just able to still produce some insulin as well that keeps away the symptoms itself. And many people with type 2 diabetes sometimes have a blood test and they think, oh, I didn't know I had diabetes itself. And it's due to the way that the body's just coping, managing with the extra glucose demand itself. But to put them in a nutshell, type 2 diabetes it's the main cause of diabetes. Around 90% of people with diabetes live with type 2 diabetes, and a lot of it is caused by what we call insulin resistance itself. And there's an extra demand on the pancreas itself to make more insulin. And the way we describe it, certainly in Desmond training and in our sessions, is a bit like lock and key, the lock and key analogy, where the pancreas makes the keys and the locks are the cells, and the glucose is used in the cells as energy itself. And what happens is the glucose demand gets more and more, but also as insulin resistance gets more and more as well. Then obviously as a combination, the pancreas has to work harder, which then over time can make the pancreas get more and more tired, and that can ultimately lead to an increase in insulin resistance, but also increasing glucose levels, and ultimately the person will eventually have that diagnosis of type 2 diabetes. But there's many causes for type 2 diabetes, not just weight as well. So being overweight, that has about an 80% risk of the causes of type 2 diabetes. but we know there are many other causes in relation to previous gestational diabetes, lifestyle factors, sociological factors, psychological factors, and we talk about social determinants of health and how some backgrounds and ethnic backgrounds as well puts people more of a heightened risk. But because there's some keys being produced for the person who develops type 2 diabetes, the management usually is metformin's the first line therapy, but the therapies that we try and quickly get on board, particularly in relation to what we call SGLT2 inhibitors, have a cardiovascular and renal benefit as well. So we look beyond just glucose management, and we look at things that have cardiovascular and renal health as well, because people with type 2 obviously going to be living with this condition much more over a long period of time. With type 1 diabetes, we describe it as an autoimmune condition where the insulin producing cells, which are the beta cells themselves, and they get destroyed by the body itself, an autoimmune cause. And generally the person would have a genetic risk factor, and then some form of reaction or event occurs. Usually some of the triggers could be stress, could be an illness, could be an injury, something causes, it could be something even subtle that you don't even notice, that just causes the body to make this reaction happen. And from there, the person has a sudden onset, generally sudden, could be a few weeks, could be a few months even, where the person has the destruction to their beta cells, and then it happens very quickly, and the person obviously needs insulin to survive as well. So the way that the two types of diabetes managed are very different, and we used to think type 1 was under 40 and type 2 was over 40, but in fact we want to put age away from factors as well, because certainly in Leicester, the youngest person with type 2 was diagnosed at the age of 8, and I've known someone to be diagnosed with type 1 at the age in their 60s as well. So age really should be almost irrelevant in some ways. It's all about the physiological aspect of the person themselves. And ultimately, the type of diabetes is crucial. And one thing that's come out of ADA is the conference is this hashtag called Shush the Stigma. And that's a really important thing, because even I remember when I was first on the wards as a nurse and a physio, not Laura or Julia, but another healthcare professional said to me, should you be eating that? And that's not helpful at all, you know, when it's all related to types of diabetes as well. But even a person with type 2 diabetes, we always say moderation, not cutting out things altogether. Moderation is the key. But we know there's many other types of diabetes as well when we think about monogenic causes, gestational diabetes, LADA as well, latent autoimmune diabetes in adults, and also type 3C diabetes, which is an injury to the pancreas. And the way that each type of diabetes is managed is very different. So one size does not fit all. Hopefully that gives a bit of an insight there.
A brilliant insight, James, mate. Thank you so much. And the podcast will be available on our YouTube channel and on our website, DiabetesChat.net. So people can go back and learn and take that in a little bit more after tonight. So thank you, Laura and Julia and James, for giving us a little introduction to you and to the Leicester Diabetes Centre and to Eden, Desmond, and rounding that sort of 30-minute section there, talking about the different types of diabetes. Brilliant stuff, guys. Julian says, Leicester Diabetes Centre sounds fabulous. Brilliant stuff. So what I'm going to do is hand over to Laura, and for the next section of the evening, the guys are going to take over the space, and they've got some slides. I will be retweeting them on the Diabetes Chat account, so you can check them out later or now, whatever. Retweet them, like them, whatever, share them around, comment on them, get involved. Hashtag Diabetes Chat if you want any questions, or join the microphone, request the microphone, and you can come say hi and ask questions. So over to Laura, Julia, and James.
Thank you. You're so brilliant. Yeah, I don't know how the question bits work, but I'm happy to be interrupted at any time. I'm always very happy to be interrupted. And if I get excited, I often talk quite fast. So I will make a conscious effort to speak at a sensible pace, but I may well go off at a tangent, rattling away as well. But one of the first things I just wanted to talk about in my section briefly is about why we think it's important that healthcare professionals are educated. And it sounds probably quite obvious when you think about it, isn't it? And you'll know how important education has been in your condition. We were listening to Leah right at the start, talking about being a sponge and wanting to know as much as possible. And I think one of the things around education is that we know that in the world of the NHS, it's kind of times of austerity, and commissioners and people who fund programs like education don't necessarily have loads of money. So outcomes become really important. And I'll talk a little bit more about that as I go on, because one of the things that's probably frustrated me over many years in this job is that you won't necessarily know, as a person living with diabetes who goes for your annual review or goes for your checkups, whether your healthcare professional is educated or not. And there's no research trial really where you can go, well, the people who've had education get treated better and their patients have better outcomes than the people who don't have education. So what we try to say and what we try to prove all the time with the education that we do with healthcare professionals is that it's a cause of better outcomes. So we know through a lot of the evaluation programs that we've done in areas that we've worked, if you have healthcare professionals that are educated, patients and data, national diabetes audit data and other data tends to be improved. Now, what you could say is that we're probably a contributory factor to that, but it's really hard to say directly that healthcare professional education means better outcomes for people, which frustrates me. I'd like that to be a magic link, but I'm still working on it. My wand hasn't worked quite just yet on that one. So what we do know, and I want to kind of combine two things really, if I can, a little bit in my first few minutes, is around this piece about healthcare professional education. But also I mentioned earlier about how important I think compassion is and compassionate leadership. And for me, the two are really inexplicably linked as well, in that if we are practicing compassion, that means we're caring both about people, but we're also caring about results. And both of those are really important. And one of the things that I like is looking at looking at people. And there's a piece of research that talked about patients generally want three qualities in their healthcare professional. One of those is they want a healthcare professional who listens. And you'll know if these resonate for you or not. The second one of those is they want a healthcare professional who's informed and that can explain things well to them, hence the need for education. And they also, thirdly, want someone who is compassionate or to be treated with compassion. And I know that if I'm in the shoes of a patient, they're exactly some of the things that I want. Now, some people think that that's the soft stuff. And they go, oh, you know, that leadership, that compassion, that's just all the soft and fluffy waffle, isn't it? And I'm great at the soft fluff, as anyone who knows me will know. But actually, research tells us that soft stuff is actually the hard stuff. When we get the soft bit right in terms of looking after people, looking after staff, getting engaged, happy staff, we know, because the research tells us really clearly, that that gives better outcomes for patients. And that links to both mortality in terms of inpatient deaths, that links to safety, and it links to a whole load more different things as well. So going way back to 2013, and Sir Robert Francis's report into the Mid-Staffs Inquiry, was he said that all healthcare professionals need to be safe practicing, and they need to demonstrate knowledge and competence. And that really underpins what we do. So I'm going to try and weave the two bits in together a little bit as well, in terms of both the healthcare professional education and this need that I believe for compassion. So as I said earlier, we know that we're one of many and that there's loads of healthcare education programs out there. So how do we stand out? How are we different? Why should people choose us in terms of over anyone else? I think there's a couple of reasons. One of those is that we're based at the Leicester Diabetes Centre. We've told you a little bit about that work. You know, we've got three professors actually, who are leading and spearheading our centre, who are probably in the top 10 of diabetes researchers worldwide. So we know that the work that we put out there in terms of education is evidence-based, and that's really important, partly, as we were saying earlier when I was talking with Tom, that the world of diabetes is changing so fast. Literally, as soon as we write a program, it's pretty much history, and we then have to rewrite it and then update it. So it's really important that you've got people that are credible, that people who can use the evidence and can use that into education for us. And I think the other thing that's really important that we have is all of our educators are also clinicians. So people like James, people like Vicky, who I think is on the call as well, who's amazing. They're people who are both educators, but they're also practicing clinicians. So they're treating people with diabetes type 1, type 2 in their day job as well. And it's that mix, because I think in order to educate, you need stories. And the stories come from the patients that you see. You know, we could talk all night about patients that we've seen that have touched our lives, but it's those stories of when things have gone well, when things haven't, the stories about success that we bring to our training. So I think that's a couple of the reasons as to why I think we're so good within our team. I talked earlier about who we educate in terms of all of those staff, you know, both support staff and registered staff. So the staff from the healthcare assistant in the practice who's doing people's annual reviews, who's taking bloods, right through to the people that are listening and the people that are prescribing. So we train all of those different staff. And how do we do that in terms of our Eden work? Well, we do that both face-to-face all the time. Pre-pandemic, we were a Premier Inn team. We trawled the length of the country, having Premier Inn breakfasts, delivering training, getting in the car, driving back. And then obviously the pandemic put a stop to our sausage breakfast in the Premier Inn. And we went virtually online for a couple of years completely. And then what we've done since that time is we've probably moved back now to a bit of a hybrid blend where I think we probably get the best of both worlds. So we are back to doing face-to-face education nationally for those people who want it. In fact, I had a call with Isle of Man and Cornwall on Friday, and I quite fancied both of those gigs. But we always have hands up for the good ones. But actually what we do is we do a range of different styles in our education. So lots of people talk about online learning or e-learning modules, and the pandemic meant we did a lot of those. I think people are completely weary of that stuff, if I'm honest. So we try to be much more interactive in our training. So we create infographics, we do webinars, we do live programs. And one of the things that has always really underpinned Eden, and I think will always continue to do so, certainly at least while I'm around, is that all of our programs pretty much come with a mentoring component as well. And if I talk a little bit about that, what I mean by that is you can do a great course, and some of you will know, and I know, Tom, you're a teacher and other people may have experience. You can go on a course and fill in a happy sheet at the end of the day and say that you've had a really great day. And I think that's relatively easy to do. But actually 2 or 3 months later, when that patient that you learnt about, whether that's injectable therapies, technology, renal, whatever that subject was, rocks up in your practice or on your ward, you kind of go, what did I learn? Where was that folder on the shelf? So for us, the mentoring element, which is a live group session that combines with most of our programs, means that staff can come and discuss case studies. They can come and learn from the experts. They can come and ask the dumb, stupid questions that they might not want to ask someone in their practice, in terms of being able to just consolidate that learning. And I think that's probably what makes us a little bit unique, I would say. What do we deliver? Well, there's always more that we could deliver. 5, 10, 12 years ago, we were probably just doing stuff around insulin, whereas now we're doing type 1, type 2, technology, cardiorenal, weight management, carb counting, oral therapies, injectable therapies, annual review, care processes, all the drugs. Our job is to stay ahead of the curve, and that's what we try to do. And just today, interestingly, if anyone is interested, we have launched a brand new Instagram site, which we've called My Eden. And this was very much recognizing that for the healthcare professional of today, they want stuff on the move. They want stuff as they're walking around the ward. They want stuff as they're going between patients. They probably want stuff as they're sitting on the toilet, without being rude, that they can just look at in a couple of minutes and glance and pick up some information. So My Eden has been designed to be really brief, at the touch of a button, at your fingertips, kind of things that you might need to know. And then there's opportunities to dive in further and understand more as well. So that's a little bit about some of our Eden work and what we do. And I just wanted to bring back a little bit, I suppose, into the kind of, I talked about being passionate about compassion and why that matters. We know that compassionate care, if you like, has huge benefits to staff. Staff generally are more engaged, they're more supported in their work. We know that to a person with a long-term condition, that they get higher quality care if they're treated with compassion. We know they have greater satisfaction. We know that they have less mortality, to put it starkly. And we know that there's great benefits to kind of like the system as well, in terms of quality, performance, finance and outcomes. And as much as we like to think quality is at the heart of things, we know that the pound signs matter as well in terms of funding for things. So one of a guy that I absolutely love to follow is a gentleman called Michael West, and he's done a lot of research into compassion in the NHS. And he says that compassion is the most powerful healthcare intervention there is today. So that's perhaps something for us to think about and reflect as we go away from here today. I genuinely believe it is. And he says that compassionate teams that have supportive work, they have clear goals, they have strong leadership, have better outcomes for their people. And we know that the teams that have the flip of that in terms of poorer care have lower patient satisfaction and poorer patient outcomes or clinical outcomes. So for me, it's the blend of both of those two, just as I sort of begin to wrap up my bit, really. But just a question really in terms of how, and perhaps people will come off and talk about this after, how does healthcare professional being educated help you then? For me, it's around this knowledge, the confidence, the competence, the safety that a healthcare professional who's educated can then share that knowledge with you, and you can feel confident in your care. So for me, the two are mutually compatible and kind of inexplicably linked, that a healthcare professional who's knowledge confident and safe means that you get knowledge confident, safe care, which goes back to that point I made at the start about caring about people and caring about results. We know as well that the workforce challenges for healthcare professionals are probably greater than they have ever been. Staff are leaving, staff are retiring, skilled staff. We know all of those challenges, but actually patient-centred care or person-centred care and partnership is vital. The quality matters. We know that the education is so important. And when we talk in a moment about self-management and we talk about peer support, you're the people who manage yourself. We can only train people to support you as best they can in the time that they are with you, which we know is a really brief amount of time every year as well. So we also know that care is more complex than ever. It changes so fast, as I've said. So we know that I think there's not any healthcare professional that won't see people with diabetes. We know that 1 in 5 people in an inpatient bed has diabetes of some kind. Just thinking about physios, I was talking to someone the other day that said that they now look at, even in a sort of a musculoskeletal physiotherapist in an outpatient GP setting, will be looking at how many associated conditions or long-term conditions that person has, as well as their knee, their hip, their shoulder, whatever. So there's no role that doesn't benefit from education. And that knowledge, that confidence, that competence is what we aim to give people. So let me pause there and hand on to Julia. Is that what you'd like us to do?
That was absolutely amazing, Laura. Thank you so much. Let's continue. Absolutely. Brilliant stuff. Loved it.
Thanks, Laura. Yeah, that was really interesting hearing all about that. And I suppose it leads on quite nicely to thinking about Desmond and that sort of self-management element. And like you were just mentioning there, that, patients or people living with type 2 diabetes are only with their healthcare professionals for a very short amount of time. So self-management is something that is quite key to knowing, or for helping patients to understand more about their condition. So just to give a bit of background, self-management is a term that's sort of used to include all the actions, all the things that somebody has to sort of recognise and treat and manage their own health. And they can do this independently, or they might do this in partnership with the healthcare system. But that's always then linked in with what we call the self-management education. And really that's any form of education or training people with long-term conditions, very much focused, as Desmond is, around helping them to develop the knowledge and the skills, but even more importantly, the confidence that they need to actually go away and manage their condition effectively when they're not with that healthcare professional or in that healthcare system. So, thinking back to sort of why Desmond, and like we were saying already, is that Desmond, like Eden, is one of many programs that are around for sort of self-management. And you can sort of find there's lots of different ones out there, whether that's type 1 or type 2. But certainly within Desmond, just thinking about the background, very much came as a collaborative of different healthcare professionals, of clinicians back in 2003. So there was consultant endocrinologists, there was psychologists, dietitians, diabetes specialist nurses, and people with type 2 diabetes, all coming together to begin the development of this sort of national education programme for people with type 2 diabetes. And then it was in 2006 that it actually saw the national rollout of that Desmond newly diagnosed module, as well as what we call the foundation module for people that were living with established type 2 diabetes. And since then, since those sort of first two sort of modules as such, it's gone from strength to strength with the introduction of other programs such as Walking Away from Diabetes, Let's Prevent Diabetes, for people who are at risk of developing type 2 diabetes. And then, and I'll come on to sort of My Desmond in a little bit, but in 2018, we then came on to develop the online self-management program called My Desmond, which is one of our online offerings for around health education for patients living with type 2 diabetes, and they can work through a program as such in their own time. So within Desmond and My Desmond, there are sections and sessions, whether this is face-to-face, virtual, or online in the online self-management program. There is information and education around the glucose story, so very much what happens in the body when we don't have diabetes, and then what changes. So it does look at a little bit to do with the different types of diabetes, but that's to help people with their understanding and their knowledge around that. But then very much the emphasis then goes on to the type 2 diabetes journey and story as that goes through. Introducing people to monitoring, certainly around that long-term testing with their HbA1c, but again, looking at that sort of self-monitoring side, the finger prick testing, if that is something that particular group of people are doing, sharing their stories, sharing their experiences, learning from each other, as well as then looking into all the sort of food choices. So thinking about food and glucose control, healthy food choices that they, again, sharing what they've already found, what they've already been doing. And with all these sorts of subjects that are happening, the Desmond educator is very much a facilitator within that session. They're facilitating all those sharing stories and all that experiences that all those people in that room have had. And with the adult learning theories that sort of underpin Desmond, we very much think about those vicarious learning. So they're learning from each other. They're looking at role models. They're looking at people that have gone through very much the same experiences that they have. And what we know is that people learn that education, thinking about that knowledge. They learn much better through other people and those sharing stories. So that's why the educator, the sort of training around the Desmond sort of philosophy is quite key to the delivery of Desmond, to sort of help with that, what we call those vicarious learning and those mastery experience. So we have lots of food models and food pictures that they can pick up and pass around. Although some of that has obviously changed with COVID, and some of those resources have gone to sort of more pointing at things rather than picking it up. But it's slowly getting back to the way it was before. Like we were saying, to do a lot of travelling around the country as trainers, delivering, working with educators around the country, but now very much sort of based out of the LDC doing that. But I think, again, looking back at sort of Desmond and thinking about the achievement that Desmond had, we're looking at 20 years now of Desmond, and what a great achievement that's been. And certainly that's a big thing through the Leicester Diabetes Centre, as with Eden being 10 years old. And it's kind of hard to believe now that we've had over 500,000 people with newly diagnosed type 2 diabetes that have taken part in Desmond groups since that pilot work back in 2003, with more people attending our prevention groups, as well as over now 40,000 people taking part in our sort of digital programs that are available on the My Desmond platform, which kind of brings me quite nicely onto My Desmond. So My Desmond is our online self-management program, sort of looking at accessing all the things that I've just been talking about, but very much in the palm of somebody's hand. So My Desmond is a web app that can sit on any device, so that's a mobile phone or a fixed desktop. So it's not a native app that you download from an app store. It can appear, but once you have accessed it on your smartphone, for example, through your web browser, you can actually save it to your home screen to make it look like an app. And what this means is that My Desmond can reach even more people than they may normally have had to offer to people if it was just an app or just on somebody's computer. And this is for people that may be awaiting access to a face-to-face group session. It might be somebody that's already had access to those group sessions, and this is their continual self-management education program. But again, that philosophy is around the fact that as healthcare professionals, we're only with people living with type 2 diabetes a very small percentage of the time. So it's trying to help them understand that management of that condition and how to carry on with that. So it's a program that they can work through in their own time, follows very interactive activities again. So it's not just that sort of didactic or that sort of all-in-one method with lots of information. It's very much broken down into sort of bite-sized chunks of education material with videos and audio files that people can listen to. And also, you know, the sort of, we've now started to develop testimonials of real lived experiences of people living with type 2 diabetes, very much in our programs where we're sort of trying to work with younger people with type 2 diabetes as well. Because the program sort of with My Desmond offers a way, it's got systems built within it that start to offer a way for individuals to access that, what we were calling peer support. And Laura mentioned this, and feel free to jump in, Laura, at any time when we're talking about peer support. But with My Desmond, it's very much the functionalities built into it it has a chat forum associated with it that people can talk to each other. They can share their ideas now in a virtual sort of space, similar to what we're doing, but very much just that sort of typing, you know, posing questions, answering questions. There's notifications about when people have answered questions or if there's new responses. So it's trying to find it. We've been working hard to try and bring people together within that sort of online environment. And we've been doing some work with some of our younger people with type 2 diabetes, so asking them what they would want. And this was their big thing, their big wish was to have just a space as younger individuals living with type 2 diabetes in particular, where they could speak to each other and just sort of share ideas in their sort of own little sort of bubble, I suppose. So that's one of the new developing programs that sit on My Desmond. So My Desmond is now what we would call a platform, and within My Desmond we have lots of other programs. So we have the Let's Prevent program, we have Baby Steps for Gestational Diabetes, we have the Leaner program, which is for those low energy diets as well, and then our research projects, which looking at, like I say, younger people with type 2 diabetes. And we know from people engaging with these sorts of online programs and thinking about that sort of self-management education, we know that people feel, we've got some evaluation around My Desmond where it talks about that sort of 85% of people find that they better understand their condition. They've become 62% have become more active. 45% found they were able to better manage their stress. There's a emotional management built into the program, looking at diabetes related distress as well. But looking back at that self-management module, or what we want from self-management, is all about improving self-confidence, and 58% of people do report increased self-confidence, and that is one of the ultimate aims of self-management education, is about that, what we call self-efficacy, really helping people to believe and feel that they can make the changes that they feel that they are ready to make or want to make. So that kind of brings me to the end of that little bit around My Desmond, really. And I think just to sort of bring it back, I suppose, just to finish off with that sort of peer support element of it, and that this comes through not just in the online program where we have got those sort of chat forums, but also in those group scenarios where you know, peer support can be a vast range of approaches, where people with similar long-term conditions or health experience can support each other to better understand their condition and aid that sort of recovery, or that self-management. And it can be very much more formal or informal. And I think we were talking a bit about it earlier, weren't we, Laura? We were saying that really the healthcare professionals, and certainly looking at that education, can be the bridge between helping people to access this type of peer support, whether that's ad hoc, whether that's regularly, whether that's through trained healthcare professionals or volunteers that can sort of help bring these people together to sort of have that lived experience to help each other and to learn from each other.
Yeah, totally. James, were you going to talk? Are we okay for time, Tom? Or James was going to talk very, very briefly about peer support. But
absolutely.
Yeah,
we've got a question from Liz. If we can maybe bring Liz up to the panel. But I just thought that was absolutely incredible, Julia. Thank you so much for sharing. Congratulations on 20 years of Desmond. The things that you're doing for the community is just so inspiring. And we talk about this so many times on the diabetes chat, is that we as people live with diabetes, all types of diabetes, only see our diabetes team a small percentage of the time. So having amazing platforms like the My Desmond to be able to find community and learn and educate yourself, but be able to talk to all others, normalize things, ask questions, share ideas, experience, I just think it's tremendous. So well done for all the amazing things you're doing. Let's bring Liz. I think she got a question.
Hi, thanks a lot for letting me in to ask a question. I just want to say this is a really interesting chat this evening. I wanted to join. My question is to Laura. Laura, I'm actually based in Ireland, and I was wondering, do you guys do training over here with the HSC and the various different hospitals? Julia, I'm aware that Desmond is something that's rolled out here to type 1 patients. I should have said I'm a type 1 diabetic 45 years now. And Laura, one of the things that I wanted to say that really resonated with me when you mentioned about compassion and having a compassionate leader within a diabetes team. In that 45 years of experience of using a diabetes healthcare professional, I haven't seen it that often. In the last, I'd say 5 years, I see it more and more. But for 40 years, there wasn't a lot of compassion around diabetes. But it's just a question I want to ask about how much you work here in Ireland, or if indeed you do. Thanks.
Yeah, thank you, Liz. Great question. And yeah, I guess we've probably all been on the receiving end of the good and the bad and the ugly in terms of care, haven't we, as well? And let's hope there's a tidal shift towards compassion anyway. There would be if I had my way. We haven't worked in Ireland. We have worked in a number of different places in both the UK and abroad. We have got a programme running in Ireland at the moment around care home education, but that's in partnership with Sanofi. But we will work anywhere where people approach us or if we approach people. So maybe we swap details after and make a contact. We're quite a small team, so our work is pretty much only rate limited by the amount of us that can go to places and do training, really. So, but always looking for new places to educate, always looking for new opportunities to get the message out there and to help upskill people. So if you want to link to me, that would be absolutely perfect, and see if there's anything that I can do to promote some of the work that we do.
I definitely will do that, because here in Ireland, again, just our health services run by the HSC, and we have about, I'd say, 9 major hospitals in the country, but about 32 that are diabetes centres. Staffing is a major issue here, but training for diabetes is something that I think is quite lacking here. But I'd love to touch base with you when this is finished. And again, thank you for this evening.
Perfect. No, thank you for joining. And yes, message me, please do so. Thanks, Liz.
Brilliant stuff. Over to you, Mr. Ridgway.
Yeah, so around peer support, I think Julia hit the nail on the head with peer support. We know that healthcare professionals and services, particularly to the NHS and clearly in Ireland as well, you know, we're all, it's a hard time at the moment, you know, funding's being cut as well, but a light, I think, that not only just carrying on what we're doing and trying to innovate and educate and inspire, but also one area, and I think that Parth Carr, with his work on the 6 principles of peer support, when that really came to light, and also Diabetes UK have started doing work around peer support, particularly for younger adults. One thing that ourselves upstairs in the Leicester Diabetes Centre, but also our clinical team as well, who I'm part of, we thought, is there something added in relation to peer support? Obviously, we know it's there embedded, for example, in this space, but also in the self-management education programs such as Daphne and also Desmond. But they're things that sort of come on moments in time with one's diabetes as well, and I'm very proud to be part of a project, as I call it, but it's more than a project to me. It also helps me along the way as well. So my chief, the lead of the diabetes service in Leicester, approached me at the start of this year and says, we've got more and more people starting on Omnipod. I think it's up to around 80 users now, and he says, I want to try to do a peer support group for those who are using Omnipod. Instead of making a general diabetes peer support group, I want to make it specific on this occasion and see what impact it has. So we do, and I've been leading on it and facilitate it since that time, and we're at 6 months now. And what we do with each person, so we've got a good near 15 to 20% of all the Omnipod users in Leicester, Leicestershire and Rutland are part of it now, and it's growing as well. And we, for each person that comes to it, they complete a knowledge and confidence questionnaire, but also what we call a PAID score, which is a problems, areas and diabetes distress score, which gives a scale on someone's level of distress. And then we've just completed our 6-month analysis of it as well. We've identified levels of distress have generally reduced as well, and knowledge in some areas has slightly increased as well, which is great. But it's not just the evidence around that, the qualitative. We've done an evaluation on the project itself, and it shows the impact that peer support has. So the group itself meets once a month face to face at the Leicester Diabetes Centre. So it's not just a project that's embedded both clinically, but it's a project embedded in the Leicester Diabetes Centre as well, who's right at the heart of it. I'm very proud to be part of it. And in addition to the monthly sessions, we have an active WhatsApp group, and it's one that is really full of positivity, and everyone's really encouraging. And there was one example of how a person might have to ring the ambulance service or 111 in a dire situation where their glucose levels were going a bit too high and they were feeling a bit worried. So we all kind of got together, and not got together, but on the WhatsApp itself, they messaged it. I think it was like 10 o'clock at night, and they said, oh, what do you think I should do? So we all advised on fix up things like practical things like pump sick day rules, and you know, it was more reassurance for them. And then they went into the night and doing what they could and said, how are you the next day? And they said, all fine. And I think it's situations like that that can make a big difference, and just having that support. And I call it support connecting at times of disconnection, because you have, for example, moments of get-togethers, for example this, but then what happens on the times where you're not together, you want something on a needs must basis as well. So the WhatsApp group has been a real revelation itself. And the way that we've done the project itself, the peer support group, is that at the start of it, when we first got together, we asked them, can you list your hot topics of what you would like to discuss, rather than here's the agenda of the peer support group and we'll see you next month. So the peers, it's led by people with diabetes, so I facilitate it, given a balanced approach of both HCP and the person living with diabetes using the Omnipod itself. And we we drive, you know, it's for people, of the people, by the people, ultimately. Sounds cheesy, but it is. And it's amazing when I remember that first session and you meet people you've never met before, but you've got this instant connection. You start talking about basal rates and bolus doses and correction ratios and use of the pod itself. And one question we get asked is, you know, wouldn't it be better having a general insulin pump group? And it's sometimes you could say yes, but then there's many times that we found that having a specific pump group actually has had a real benefit itself, because there's so much specific things when you talk about patch pumps that wouldn't relate so strongly, but also having this device there, you know, you're a part of a collective group itself, a unique group that doesn't resonate with other groups themselves. You know, when you think about other pumps doing hybrid closed loop therapies, for example, and there's really good little tips that each person gives as well, and we talk in the hot topics themselves. We not just talk about the pod specific things. It's amazing how you talk about general things anyway. So I know I could waffle on forever about this peer support group. So, but basically, one thing that we are starting to see in the Diabetes Centre is that this, I think, has a place beyond just traditional management of diabetes within an NHS service. And I think this should be part of the service itself. You know, when we talk about peer support groups, it's quite hard of knowing how to set up, how to facilitate a peer support group. We know the 6 principles are there from set up by NHS England and Pathcar, but they don't really mention too much around here's how you run it, here's how you facilitate it, etc. And that's one thing that we feel there may be a future need for, of almost guiding people to set up and run peer support groups, and then seeing how they go basically. So we're just at the start of this little planting seed, and I think it's got a long way to go to become a nice big blossoming tree as well. Bit cheesy at the end there.
James is pretty humble about this as well. He does this in his own time, on top of 2 other jobs. The feedback from the group has been absolutely unbelievable in terms of people saying it's a lifeline in 30 years. I haven't felt this supported, etc. So just wanted to add that in as well, because he's probably too self-deprecating to say some of that.
I absolutely second that, Laura. I think James is just such a fantastic advocate for people in the diabetes community, and the peer support group is just fabulous. I love that you've got both perspectives in your balancing act in terms of someone who has diabetes, but also someone who is a DSN and educator. So I love how, like you say, it's for the people, by the people, and how people get involved, and it's led by them, and you're there to help and assist and facilitate. And I just think it's absolutely tremendous. And it's something like you've alluded to, James, is I hope that this becomes part of the NHS package where all the centres across the country are having these sort of peer support groups. I love how inclusive it is to the Omnipod, because I think, like you were saying, is if you had a pump one, it might be too much in terms of trying to facilitate and cater to everyone's needs, whereas the specific group is for people on that journey. And so should there hopefully be other groups or other pumps or pens or whatever. So tremendous work, James. And I think you just really hit it on the nail, the importance of peer support. And I think the next step is integrating it into the NHS and having that access for all people. So well done, James.
Thank you. And I think the future is positive. Me and Laura had good discussions about peer support in general earlier today, and we've certainly got eyes on the future as well. So watch this space, I suppose.
Indeed. Laura, James, and Julia, thank you so much for your chat tonight with us. Was there anything else on your agenda, or was that the coverage of tonight? I think it's just been tremendous.
Yeah, done from my end.
Same for me.
You can relax a bit now. But honestly, I think it's been such a fascinating diabetes chat tonight, learning about the Leicester Diabetes Centre, Eden and Desmond tonight, hearing different perspectives of diabetes. We learn about what diabetes is and the different types of diabetes. So thank you, James, for sharing that. We learned a little bit about you guys and your background in diabetes care and why diabetes fascinates you. But then we went into detail, a lot of detail about the Leicester Diabetes Centre and the program Desmond and Eden. I just think they're absolutely tremendous. I love seeing all the tweets from both accounts and seeing all the little mini sessions you do where you get educators who come to your sessions and you're showing them different types of food. And there was a tweet I saw a few months ago where you invited people to come along and you were doing your education sessions, and then it got to lunchtime and you said, right, this is where we continue learning. And a person with diabetes has to keep thinking of these decisions and what they need to do. And I really found it interesting how you had different areas set up and people were checking how many carbs and if they had diabetes, they were given like a fake number and they had to decide what they needed to do. But really, really great stuff. Laura, where can people check out more information about Desmond and Eden and the Leicester Diabetes Centre? Where can people check out the social media?
Point. We've got websites, we've got Twitter handles, we've got LinkedIn, we've got Facebook, we've got Instagram. I'm not sure whether James, who's doing our chief tech bits for tonight, has put bits in the chat. Have you, James, as well? You probably tagged everything as well. We've got websites which are kind of okay-ish. Eden one is under construction, Desmond one is better, LDC one is okay. It's a bit like most things. As soon as you start them, they become an unwieldy beast that somebody has to update all of the time. So, and again, happy for anyone to direct message us via here or anything else as well. It would be great to hear from people.
Brilliant stuff. Thank you so much, Laura, James, and Julie, for coming on the Diabetes Chat tonight. It's been really, really fascinating. The turnout tonight has been tremendous. I hope that you guys have taken away something from tonight. It will be available on our website, diabeteschat.net, on the YouTube channel. And if you have any questions specific about the Leicester Diabetes Centre or Eden or Desmond or anything that's been covered tonight, please tag the guys, Laura, James, Julia, Desmond or Eden, or you can tweet out Diabetes Chat and we'll get it over to the guys because I know they'll be very supportive to help. So once again, thank you, Laura, James and Julia for your time tonight, and also all the hard work preparation in setting up tonight with our meetings and emails and all the tweets and stuff tonight. It's been incredible. Thank you for your support, for everything that you're doing for the diabetes community. Cheers, guys.
Thank you.
Thank you for having us. Yeah, great opportunity.
Thank you.
Loved listening to your talk before as well. So thank you so much for letting us in.
Yeah, thank you.
Absolutely.
Take care, everyone.